Hey guys, welcome back to my channel. This is Dr. Rajeshwar from YR Pharma Tube. In this lesson, I would like to discuss the classification of antihistaminic agents. In the last video, I described the introduction of antihistamines in which you learnt the nomenclature, ionization, tautomerism, biosynthesis and metabolism of histamine, types of histamine receptors and histamine receptors distribution in the human body. If you did not watch that video, I will give a link right below this video in the description. Watch it. Outlines of the lecture. By the end of this video, you will understand what are antihistamines, how they are classified into three different classes of drugs such as first generation antihistamines, second generation antihistamines and dual acting antihistamines. Coming to antihistamines. The term antihistamine historically has referred to drugs that antagonize the actions of histamine H1 receptors rather than H2 receptors. In other words, they are the drugs that block the action of histamine at histamine receptors. The development of antihistamine drugs began more than 5 decades ago with the discovery of piperazine. This piperazine was able to protect animals from the bronchial spasm which was induced by histamine. This finding was allowed by the synthesis of a number of N-phenylethylenediamines with antihistaminic activities superior to piperazine. Furthermore, traditional structure activity studies in this series based largely on the principles of isosterism and functional group modification which led to the introduction in the 1940s to 1970s of a variety of H1 antagonists containing the diaryl alkylamine framework. These H1 antagonists referred to now as the first generation or classical antihistamines which are related structurally and include a number of aminoalkyl ethers, ethylenediamines, piperazines, propylamines, phenothiazines and dibenzocycloheptines. In addition to H1 receptor antagonism, these drugs display an array of other pharmacological activities which contribute toward therapeutic applications and adverse reactions. More recently, a number of second generation or non-sedating antihistamines have been developed and introduced. The second generation agents bear some structural resemblance to the first generation agents but have been modified to be more specific in action and limited in their distribution profiles. Some dual acting antihistamines were also recognized in recent times. Classification of antihistamines. Antihistamines are categorized as first and second generation antihistamines, which generally based on whether they cause greater or lesser sedation, that is, based primarily on their pharmacological profiles. First generation antihistamines. They are oldest classical antihistaminic drugs and are relatively inexpensive and widely available, so called as first generation antihistamines. The second generation antihistamines are newer and non-sedating drugs that are much more selective for peripheral H1 receptors in preference to the CNS histaminergic and cholinergic receptors. This selectivity significantly reduces the occurrence of adverse drug reactions compared with the first generation agents while still providing effective relief improved of allergic conditions. They reduce allergic response with little or no sedation at all. For example, cetirizine, loratadine, fexofenadine, astemizole, mesolastin, terfenadine, etc. Compounds that block the release of histamine from mast cells and antagonize the actions of histamine at H1 receptors are known as dual-acting antihistamines. Coming to the first generation antihistamines. H1 histamine receptor blockers can be grouped according to the chemical structures. Number 1, aminoalkyl ethers or ethanolamines. Number 2, ethylenediamines. Number 3, alkylamines or propylamine derivatives. Number 4, piperazine or cyclizine derivatives. Number 5, phenothiazine derivatives. And number 6, dibenzocycloheptines and dibenzocycloheptanes. and others say miscellaneous drugs that do not belong to a specific chemical classification. In the coming slides, we see the details of the individual classes of drugs with structures and other properties. The first class of first generation antihistaminics are aminoalkyl ethers, are also known as ethanolamines. They are characterized by the presence of a CHO connecting moiety at X and 2 or 3 carbon atoms as the linking moiety between the key diaryl and tertiary amino groups. The aromatic groups AR and AR1 are usually phenyl or substituted phenyl, thionenyl or pyridyl. These aryl substituents are attached to the X group, which is a nitrogen atom in the ethylenediamines, a carbon attached to an ether oxygen atom in the ethanolamine ether series, or only a carbon atom in the alkylamine series. The spacer is usually 2 or 3 carbons in length, and it may be in a ring, branched and saturated or unsaturated. The word spacer is used because the number of carbon atoms ranges from 2 to 3. The R groups attached to the aliphatic amine are usually simple alkyl groups, usually methyl or occasionally aralkyl groups. One of the early thiophene containing analogues was carcinogenic in rats. After thiophene versus benzene replacement in other series of compounds demonstrated some toxic effects, thiophene has been relegated to one of the low priority choices for isosteric replacement of a phenyl group. Clemastine and diphenylpyrrolene differ from the basic structural pattern in that the basic nitrogen moiety and at least part of the carbon chain is part of a heterocyclic ring system, and that there are 3 carbon atoms between the oxygen and nitrogen atoms. The simple diphenyl derivative diphenhydramine was the first clinically useful member of the ethanolamine series and serves as the prototype. In addition to antihistaminic action, it exhibits anticholinergic, antidyskinetic, antiemetic, antitussive and sedative properties. It is not a highly active H1 antagonist. Conversion to quaternary ammonium salt does not alter the antihistaminic action greatly, but does increase the anticholinergic action. Dimenhydrinate is the 8-chlorotheophyllinate salt of the diphenhydramine and is recommended for the nausea of motion sickness and for hyperemesis gravidarum, that is nausea of pregnancy. Other therapeutically useful derivatives of diphenhydramine have been obtained by para-substitution of one of the phenyl rings. Substitution of methyl group to produce methyl diphenhydramine, methoxyl group to produce medrylamine, chloro group to produce chlorodiphenhydramine, or bromo group to produce bromodiphenhydramine. These derivatives are reported to have superior therapeutic profiles relative to diphenhydramine as a result of reduced side effects. For example, bromodiphenhydramine is more lipid soluble and is twice as effective as diphenhydramine as an antihistamine. Replacement of one of the phenyl rings of the diphenhydramine with a 2-pyridyl group as in doxylamine enhances antihistaminic activity by 40 times, and carbinoxamine results in an enhancement of 2 times greater than diphenhydramine. Doxylamine succinate is a good nighttime hypnotic when compared with secobarbital. As a result of an asymmetrically substituted benzylic carbon, many of the aminoalkyl ethers are optically active. Most studies indicate that the individual enantiomers differ significantly in antihistaminic activity, with activity residing predominantly in the S enantiomer. Diphenylpyrrolene is structurally related to diphenhydramine with the aminoalkyl side chain incorporated in a piperidine ring. It is a potent antihistaminic drug and the usual dose is 2 mg 3 to 4 times a day. Clemastine fumarate is structurally related to chlorodiphenhydramine with the aminoalkyl side chain incorporated in a pyrrolidine ring, and it has an additional benzylic methyl group. This compound has 2 chiral centers each of which is of the R absolute configuration in the dextrorotatory product. A comparison of the activities of the antipodes indicates that the asymmetric center loose to the side chain nitrogen is of lesser importance to antihistaminic activity. This member of the ethanolamine series is characterized by a longer duration of action with an activity that reaches a maximum in 5 to 7 hours and persists for 10 to 12 hours. Drowsiness is a side effect common to the tertiary aminoalkyl ethers, presumably as a result of the ability of these compounds to penetrate the blood-brain barrier and occupy central H1 receptors. Although this side effect is exploited in over-the-counter sleeping aids, it may interfere with the patient's performance of tasks requiring mental alertness. Number 2. Ethylenediamines. The earliest series of H1 antihistamines is the ethylenediamines. Two carbon spacers may appear between the two nitrogen atoms in the piperazine series. Examples of agents in this class, of which phenbenzamine was the first of these agents. Compounds with several different but closely related aromatic rings are useful and include phenyl, 2-pyridyl, halogen and methoxy substituted phenyl or pyrimidine. Thiazole, furanil and thiophene ring congeners have also been available in the past. The small alkyl substituents on basic nitrogen are usually methyl groups. A number of these agents are still used. With the exception of antazolene, all have ethylenediamine spacer. In antazolene, the alkyl tertiary amine in phenbenzamine is replaced with an imidazolene group. CNS effects, usually sedation, are very common among agents in this class. Replacement of the phenyl moiety of phenbenzamine with a 2-pyridyl system yielded triphenamine, a significantly more effective histamine receptor blocker. Substitution of a para-methoxyl group to produce pyrilamine or meperamine, chloro group to chloropyramine or bromo group to bromotriphenamine that results in a further enhancement in activity. Replacement of the benzyl group triphenamine with a 2-thioenyl methyl group provided methapyrilene, and replacement of triphenylamine's 2-pyridyl group with pyrimidinal moiety along with para-methoxyl substitution yielded thionzylamine, both which function as potent H1 receptor antagonists. In all these compounds, the aliphatic or terminal amino group is significantly more basic than the nitrogen atom bonded to the diaryl moiety. The non-bonded electrons in the diaryl nitrogen are delocalized by the aromatic ring, and the resultant reduction in electron density on nitrogen decreases basicity. Thus, the aliphatic amino group in the ethylenediamines is sufficiently basic for the formation of pharmaceutically useful salts. The ethylenediamines also display a relatively high frequency of central nervous system depressant, that is sedation, and gastrointestinal side effects. The anticholinergic and antiemetic actions of these compounds is relatively low compared to most other classical antihistamines. The piperazine and phenothiazine type antihistamines also contain the ethylenediamine moiety, but these compounds are discussed separately because they exhibit significantly different pharmacological properties. Number 3. Alkylamines or propylamines. Alkylamines or propylamines, sometimes also known as monoaminopropyl derivatives. They are characterized by an sp3 or sp2 carbon connecting atom with a carbon chain of 2 additional carbons linking the key tertiary amino and diaryl pharmacophore moieties as shown in the structure. Those propylamines with a saturated carbon connecting moiety are commonly referred to as the phenyramines. All of these phenyramines consist of a phenyl and 2-pyridyl aryl groups and a terminal dimethyl amino moiety. These compounds differ only in the phenyl substituent at the para position. With hydrogen, it is phenyramine. If replaced by chlorine, it is chlorphenyramine, and with bromine, it is bromophenyramine. The halogenated phenyramines are significantly more potent, that is 20 to 50 times, and have a longer duration of action than the parent phenyramine. All of phenyramines are chiral molecules and are marketed as racemates or the individual active dextroenantiomers as shown in the structures. The halogen substituted derivatives have been resolved by crystallization of salts formed with D-tartaric acid and antihistaminic activity residues almost exclusively in the S-stereoisomers. Those propylamines with an unsaturated connecting moiety include the open derivatives pyrobutamine and triprolidine and the cyclic analogues dimethindine and phenindamine. The conformational rigidity of the unsaturated propylamines has provided a useful model to determine distances between the key diaryl and tertiary pharmacophoric moieties in H1 receptor antagonists, a distance of 5 to 6 angstroms. For pyrobutamine and triprolidine, the E-configured geometric isomers, as shown in the structure, are active. The relative potency of triprolidine is of the same order as that of dextrochlorphenyramine. Phenindamine can be regarded as an unsaturated propylamine derivative in that the rigid ring system contains a distorted trans-alkene. Dimethindine is marketed as the racemate and its antihistaminic activity resides mainly in the levorotatory isomer. The antihistamines of the propylamine group are among the most active H1 antagonists. The agents of this class also produce less sedation than the other classical antihistamines and have little antiemetic action. They do exhibit a significant degree of anticholinergic activity, albeit less than the aminoalkyl ethers and phenothiazines. Number 4. Piperazines or cyclizines. They are related to both the ethylenediamines and the benzhydryl ethers of ethanolamines. However, the connecting moiety X is a CHN group and the carbon chain, terminal amine functionality and the nitrogen atom of the connecting group are all part of a piperazine moiety. Both the nitrogen atoms in these compounds are aliphatic and thus display comparable basicities. The primary structural differences within this series involve the nature of the para-aromatic ring substituent, hydrogen or chlorine, and more importantly, the nature of the terminal piperazine nitrogen substituent. Diaryl methylene groups, for example benzhydryl substituents like in diphenhydramine, are attached to one of the nitrogen atoms and an alkyl or aralkyl substituent is attached to the other nitrogen. Early compounds like cyclizine, chlorcyclizine, meclizine, buclizine and hydroxyzine have been widely used as antihistamines and as agents for treatment of motion sickness because they have useful central antiemetic effects. These agents have significant anticholinergic and antihistaminic properties. Anticholinergic side effects and drowsiness are common. The primary use of these compounds remains as a treatment of motion sickness and vertigo and for suppression of nausea and vomiting. Although teratogenic effects of cyclizine and meclizine have been observed in rodents, large studies have not demonstrated adverse fetal effects in humans. However, these agents are used cautiously in pregnant women and children. Oxatomide is used in Europe principally in allergic rhinitis, urticaria and in combination with albuterol in asthma. Drowsiness and sedation are noted. Hydroxyzine is used in the treatment of pruritus and at higher dosage it is used in the management of anxiety and emotional stress. Number 5. Phenothiazine derivatives are also known as tricyclic H1 antihistamines. The two aromatic groups noted in several of the classes of antihistamines can be connected to each other through additional atoms such as the heteroatoms, sulfur or oxygen, or through a short 1 or 2 carbon chain. They have the general structure shown here. The earliest potent tricyclic antihistamines were phenothiazines, where Y is equal to S and X is equal to N. The phenothiazine antihistamines contain a 2 or 3 carbon branched alkyl chain between the non-basic phenothiazine N and the aliphatic amine. They differ from the antipsychotic phenothiazine derivatives in which the side chain is usually 3 carbons long and unbranched and usually without substituents in the aromatic ring. Examples of tricyclic antihistamines which consist of phenothiazine nucleus have been shown here: promethazine, trimeprazine and methylazine. Most had pronounced sedative effects and long durations of action. Other uses included the treatment of nausea and vomiting associated with anesthesia, the treatment of motion sickness, and an antipruritic agents in the treatment of urticaria. The last class of first generation antihistamines are dibenzocycloheptines or dibenzocycloheptanes. These antihistamines may be regarded as phenothiazine analogues in which the sulfur atom has been replaced by an isosteric vinyl group as in cyproheptadine or a saturated ethyl bridge as in azatidine, and the ring nitrogen has been replaced by an sp2 carbon atom as shown in the structure. The two members of this series are closely related in structure. Azatidine is an aza isoster or pyridyl isoster of cyproheptadine in which the 10,11 double bond is reduced, which means the double bond is converted to a single bond by the addition of 2 hydrogens or protons on individual carbon atoms involved in the double bond. These agents are potent antihistamines with moderate sedation and anticholinergic potential and little antiemetic activity. Coming to the second generation antihistaminic drugs. They are more similar pharmacologically than structurally. Structurally, they are all diaryl substituted piperazines, for example citrizine, or piperidines, all others. These compounds were developed as selective H1 receptor antagonists with relatively high potency. Most of these compounds also produce prolonged antihistaminic effects as a result of slow dissolution from H1 receptors and the formation of active metabolites with similar receptor binding profiles. The second generation agents have little affinity for muscarinic, adrenergic or serotonic receptors and therefore display a lower degree of side effects associated with the antagonism at these receptors. Generally, the large aralkyl groups or polar groups linked to the piperidine or piperazine rings of these compounds reduces the affinity for muscarinic or adrenergic receptors. Perhaps most importantly, all of these compounds are devoid of sedating effects at therapeutic concentrations due to poor CNS penetration and possibly lowered affinities for central histaminic, cholinergic and adrenergic receptors. While these compounds offer several advantages over the classical antihistamines, widespread use has revealed a number of therapeutic limitations. This is probably most true for terfenadine and astemizole, which have been found to produce life-threatening arrhythmias when used concurrently with drugs that inhibit their metabolism. The second generation antihistamines are newer and non-sedating drugs that are much more selective for peripheral H1 receptors in preference to the CNS histaminergic and cholinergic receptors. This selectivity significantly reduces the concurrence of adverse drug reactions compared with the first generation agents, while still providing effective relief improved of allergic conditions. They reduce allergic response with little or no sedation at all. For example, citrizine, loratadine, fexofenadine, astemizole, misolastin, terfenadine, etc. Dual acting antihistamines. Compounds that block the release of histamine from mast cells and antagonize the actions of histamine at H1 receptors are known as dual acting antihistamines. Compounds introduced in this class over the past several years include ezelastin, ketotifen, permirolast and others. These agents have utility as ocular antihistamines and for other indications. These are the sources of this lecture. That's all in this lecture. We have learned the classification of antihistamine. We have classified antihistamines into first generation antihistaminic drugs, second generation antihistaminic drugs, and then dual acting antihistaminic drugs depending on the chemical moiety that is present in the structure, and also considered the pharmacological application of the drug. In the next lesson we will discuss about the structure activity relationship and the mechanism of action of antihistamines. Keep learning and keep watching my videos, and thank you for watching this video.